So this patient was in severe pain because of the failing root canal in this crowned first molar. So first we removed the crown by sectioning, then we removed the old restoration and also removed the GP and proceed with rubber dam isolation for biomechanical preparation. But unfortunately, I broke my final 2504 file in the mesobuccal canal, which I could not retrieve. So then I proceed with bonding, and then I applied blue colored resin over the orifices for future reroute canal treatment if needed. Then this was the core buildup, and then I removed the rubber dam and started for provisional crown. So this is my provisional crown in Luxatem. This lasted for about 9 months, and after 9 months this provisional crown broke and I could see the caries in the adjacent molar. So in that same visit I restored that molar caries under rubber dam. This is the post-op of molar restoration. Even the premolar had caries, so I restored that also under rubber dam. It was deeper than the molar. So now 000 cord preparation, cord packing followed by single zero cord packing, double cord technique. This is my impression. The 000 cord came along. This is the final crown received from the lab. It fitted perfectly. And this is the before and after X-ray and pictures comparison. Thank you.